Hi, I'm Dr. Carrie Lam.
I'm Dr. Jeremy Lam.
And I'm Dr. Michael Lam.
Today we're going to talk about the coronavirus, COVID 19 specifically, and your immune system. But we want to more focus, everyone knows about coronavirus already, how it's affected so many countries and there caused so many deaths and a lot of fear, but we want to prepare you ahead of time to boost your immune system. So that's what we're going to focus on today. So, first of all, we're going to go through how it's spread and what are the symptoms, and then what you can do to prevent transmission, and then the supplements that you might be able to take to help boost your immune system, or other ways of boosting your immune system. So, Dr. Jeremy, can you tell us a little about how coronavirus can actually spread?
So, coronavirus actually can spread through respiratory droplets. So, that means if you're coughing or if you're sneezing or if you're touching your mouth or things like that, that's how you get in contact. So, it's really important to really, if you have symptoms or signs of coronavirus, to stay at home and not to really be in contact with people. If you cough or you sneeze, cover your mouth so then you're not spraying those respiratory droplets onto other people. That's really the main thing, is to really keep good hygiene. Always wash your hands, at least wash your hands 5 to 10 times a day, so then you're not spreading it. Also wash the common surfaces in your home area and in your work area as well, and wash it with disinfectants. That's mainly the main preventative measures that you can really take.
Right.
And no shaking hands, right?
Yes.
Right. We created a new fist bump. It looks like this. Yeah. So, what are the symptoms of coronavirus, Dr. Lim?
The symptoms of coronavirus are mainly you're gonna have a fever, you're gonna have shortness of breath, and you're gonna have maybe some difficulty breathing. Those are the symptoms that you need to look out for if you have coronavirus. Other symptoms could just be flu-like symptoms like muscle aches, runny nose, runny eyes, and flu-like symptoms like that. So if you do have fever, shortness of breath, you come in contact with someone who might have coronavirus or it was in that cluster area, be sure to go to your healthcare practitioner and bring your concerns up to them.
Well, I think cough is also a very big one. But a cough can come with a common cold. So how do you know if this is the coronavirus or not? I think the biggest thing that you should look out for is the shortness of breath. Because if you have a fever, if you have a cough, it's better to actually stay home and try not to infect anyone else. So you self-quarantine yourself, stay in your room, don't really go out, try not to meet other people. But if you start having that shortness of breath, difficulty breathing, then you should probably go to the hospital or go see your healthcare provider. But make sure you protect you wear a mask, you wash your hands very well so you don't infect other people. Okay. So now we're going to talk about what supplements you can take to boost the immune system.
Well, the use of supplementation as a natural compounds to boost and support healthy immune system is not new. It varies through a gamut or a range of items. And we'll just go through the basic ones so that everybody can get a feel of what the items are possible. Especially if you have an adrenal fatigue, it is especially critical because adrenal fatigue sufferers have a tendency to have a weak immune system and the body is compromised and often fragile. And so you want to be not only prepared, but you want to be really proactive ahead of the time. However, because we know that the adrenal system is very much responsible for the anti-inflammatory effect, and sometimes if you boost the adrenals too much, you can have crashes as well. So it's walking that fine line, and everybody is different, but here are some of the items that we've brought forward. So the number one item that's historically has been around, for 80 years is the vitamin C. And this particular one called Liponano C is our favorite because it has a special liposomal delivery system that gives you a less energy dependent type of gradient to be absorbed in the small intestine. So you have a faster and a more sustain and a potential delivery system that's more powerful. Of course, you can use just regular ascorbic acid if you don't have these higher power delivery system, or ascorbyl palmitate, or more fat soluble. So the variety of them, but vitamin C is very important. The dosage I cannot go in because everybody's specific, but generally accepted doses can be 500 to 1,000, but many people can take a lot more. Depends on their state, up to 5, 10, 15, 20,000. And if you have weakness, some people can actually do IV vitamin C, where you can do 20, 30 grams or 10 grams, but those are more extraordinary situations. But for just prevention at home, vitamin C is the number one foundation. Okay, what would you say is the number two?
So, Vira Packs, we love this at home because if we're starting to even feel a scratchy throat, or starting to have some runny nose, or I'm around kids that I know are sick, I take this. It has basically echinacea, olive leaf, and cat's claw. And those herbs are all very good for helping boost your immune system. And so it also depends on the dose. Some people, if they start to take this, they could actually have more of a detox reaction or a retox reaction because it is strong. But if you're healthy, you really want to prevent getting sick, and you want to boost your immune system, you can take up to like 6 capsules 3 times a day. And so that's very high dose that you would need in order to help with the immune system.
Yeah, and these are natural compounds. It is not a medication. It's not antibiotics, so don't get confused. But it does have a boosting immune system effect. It's short term, and you have to know how to do it. So if you're healthy, you can follow the labels. If you want the extra support, you can be more aggressive. If you're not sure, then call us, and we will guide you through, especially if you have adrenal weakness or you have pre-existing conditions, okay? So everyone is very different, okay? How about this one? What do you?
Yeah, so vitamin D is also very good for your immune system. It really boosts the immune system, and so when you're having some viruses in your body, this can help modulate it and get all those antivirals in your body activated. The other good thing about the other good supplement that's against viruses is also zinc. So we have PyroZinc here. You can take it if you're just feeling some runny nose. It doesn't just have to be for the coronavirus. If you're feeling for just generally under the weather, then take some zinc as well, and that can help boost your immune system against some viruses.
Now, zinc you have to be a little bit more careful because this is not something you want to take long term. It does have a stimulatory effect and supportive of the thyroid function. So if you are already on thyroid medication, for example, you don't want to take this without talking to your doctor to make sure you don't go in, especially if you're long term, you can get into hyperthyroid, okay?
And many of these, you want to make sure if you're starting out and you already feel it, you take it right away. You don't want to wait for another 24 hours because they work best if within 24 hours of feeling something, you really boost your immune system up so that it would be able to fight.
So another thing which is quite interesting is the thing called Briotech. This is a topical skin spray. It's actually a hypochlorous acid, not hydrochloric acid. And this is a very weak antiseptic, but no alcohol. So you can use that to spray, in the service areas for cleanliness. So they come in different sizes. So you can buy it online wherever you like, okay? Anything else in terms of if you do see a doctor, what other natural things they can do to boost immune system?
Well, if you go see your doctor, there are medications that are now being used experimentally to try to see whether it would be able to help the fight the coronavirus. There's no vaccine yet, but everyone's working hard to try to create a vaccine, and hopefully it'll come out soon. But in the meantime, as it spreads, what else can your doctor do? Usually they have some antivirals that they're also trying, and some HIV medication because they are also antivirals, but they are experimental and being studied in China right now. So just let your doctor know, and then they can decide, they usually run different types of panels in order to see if you have coronavirus or not. Usually they would probably do something like a normal viral panel first to see whether you have just a normal virus. And if that comes back negative, like you're negative for flu, negative for all these other viruses, then they might go and test you further for coronavirus, but they usually have a protocol. So don't just jump to the conclusion that you have coronavirus. You could just have a normal common cold. And so just to recap what we learned today, the symptoms that you should be looking out for and be more concerned about would be more the fevers and the shortness of breath. Okay, the shortness of breath specifically. And then try not to go out if you fall sick, stay home and self-quarantine yourself. If you're not too bad, stay hydrated, rest a lot, okay? And then we talked about how to prevent transmission, cleaning up all your area, washing your hands really well every time you touch something. Try not to touch your face. And then we talked about all these supplements and ways and protocols that you can do in order to support your immune system.
If you are really in that position, there are help available, naturally non-invasive that can be very beneficial. But stay with the basics first. Just take care of yourself, and we wish you a very, very healthy time as the virus approaches, and we want everybody to be in tip-top condition. Especially if you have adrenal fatigue, we intend to be very aggressive in making sure that your immune system is up to speed. And then that way, even when you're exposed, you're able to handle it and you don't have crashes. We are already seeing in our consultation and coaching that a lot of people are very, very concerned. Do not get too anxious. Do not overly worry. It is what it is. We just are ready. When we are ready, you don't have that fear factor, and everything will be more calm, okay?